Hello and welcome to the Take Lessons benefit webinar for new hire employees. Congratulations on being hired for Take Lessons. I'm from Discovery Benefit Solutions. We are the brokerage insurance firm for Take Lessons, and we're here to explain to you what your benefits are, how much they cost, and give you real life examples so you can walk away from this video with a strong understanding of your benefits to make the most of them. These benefits are an important part of your compensation package. The presentation will be about 30 minutes long, and because it's recorded, you can pause it at any time. You can fast forward and rewind, and also view it multiple times. My name is Michael Pondrum. I'm the part owner and CEO of Discovery Benefit Solutions, and my partner Alejandra Moises is what we call our account manager, which quite simply means that both of us are available to answer any questions you have regarding benefits, regarding your new hire, regarding how they work, and everything that we talk about with you has to be 100% confidential from your employer. It's actually required by law. So please make note of our email and phone number here listed at the bottom of the screen. We'd be glad to help you out on anything that you need. So to start off the agenda, we're going to tell you what our agenda is, and then we'll go ahead and execute on that. So what does DBS do as your brokers to help with Take Lessons and employees? We're going to explain to you a little more detail on that. Then we're going to talk about who is eligible for the plan and when coverage starts. Third, we will cover Obamacare and the healthcare reform update. We're only going to give you what you need to know. And then if you want more, you can always call us. We are experts on it and trained and certified to be able to sell it. So if you need any help and more detailed questions, or would just like to know more about it, you can give us a call. And then, of course, we're going to explain all your coverages relative to Take Lessons, and also talk to you, just make sure that you're aware of the voluntary plans that the insurance company Colonial is being made available. And finally, we will remind you about what kind of forms are needed and what the process is to complete enrollment. So once again, our name is Discovery Benefit Solutions, and our intention is to be able to help you quickly and efficiently in the event the insurance companies are not answering your questions, or if you get bills that don't make any sense, or if the customer service from the insurance company is not handling it appropriately. We're here to help you. Don't wait until any bills go into collections. Picture us like a concierge service, and know that we're here for you as a resource. So, who is eligible? This is the eligibility portion. And when are they eligible? As long as you're working 30 hours or more per week, by law, you're actually considered full time. That is part of Obamacare, that threshold. And Take Lessons chooses to make a very generous time period by which you start coverage. And they make it first month following 30 days in which you've been working 30 hours or more per week. So, think about what date you've been become 30 hours threshold, and the first month following 30 days, you will start coverage under all these plans. The elections you make at this point in time as a new hire is very important, because you will be locked in with those decisions until the next open enrollment period, which happens every year, one time a year, to be effective September 1st, 2014. So think hard about what elections you're going to make, who you are going to cover, and then the only other time that you will be able to make changes other than next year in September 2014 will be if you have a family status change called a qualifying event, which would be something like a marriage, a divorce, or a death of a dependent where you can drop them, or a birth of a child. And just note that you need, if any of those happen, you need to make sure you notify talent and culture within 30 days of the event so that we can appropriately add you. If you go past that time frame, we're going to be unable to get you added onto the plan, your dependent added on the plan appropriately. As far in terms of new birth, that's tough to add. You can get past the excitement of new birth, and then within a week or so, follow up. If you're in the unfortunate circumstance of some sort of immediate needs of care for the child and mom, then you can obviously call in right away, and we can uh, work on that for you. So who are eligible? Domestic partners are eligible, both same and opposite sex, children and stepchildren. And if you are taking care of a child that's not yours biologically, as long as you have guardian court approved, that you are the guardian approved by the court rather, then you can cover them as a dependent on your insurance plan. And part of Obamacare that's been appreciated by the public is now children can be covered up to the age of 26. That's through 25. automatically, and they do not need to be a full-time student. So it's very easy to add them on. No forms necessary. Very simple. Something important to take in mind if you're a new hire that did not have prior coverage, um, and you've had a break of coverage, meaning no coverage for 63 days or more, then be aware that any condition you had prior to coming on to the TakeLessons PPO plans, you're going to have a pre-existing condition exclusion. If you're listening to this webinar and you've not yet enrolled, know that the HMO plan does not have this pre-existing condition exclusion. So if you are in a situation where you absolutely need something covered and you did not have prior coverage, enroll in the HMO plan, and it simply does not apply for that specific plan. If you have to have the PPO plan, then just be aware that this exists. Now, fortunately, Obamacare, one of the other good things about it is it effective at your next renewal for TakeLessons at September 1, 2014, all pre-existing conditions will be covered automatically. And so this will go away. It's just that until September 1st, 2014, the rule applies. So quick updates on only what you need to know. Coverage has increased for these variety of things that Obamacare enforces, such as preventative care covered at 100% as long as you go to in-network PPO or HMO providers. Dependents covered up to age 26. And then there's also a thing called essential benefits, making sure that plans meet minimum standards. These are all good things in the sense that you cover more, but it all comes at a cost. And there's also a tax that everyone is paying to support these good things, and that's 4%. So your rates are going up 4% to cover all these things, to cover the exchanges and things like that. And then also your premiums are going up due to additionally covering these other items. So just be aware that while there are some good things, that's part of the reason why premiums have actually gone up for those that are medium or income or above. So for the future, all individuals will be required to have insurance starting January 1st, 2014. So if you are deciding to waive and go without coverage, know that there will be a penalty. It will be either 1% of your income for most of you or $95 a year, whichever one is greater. And you would be payable through your tax return. So if you decide not to January 1, 2014, then it would apply to when you file your January 1st, 2014 taxes. You will then be expected to true up and pay for that penalty. So we highly recommend you enroll. Once again, we remind you that effective at the next renewal, pre-existing condition exclusion will be removed for the PPOs and for all the plans. And then also, pediatric dental will be offered automatically as part of the medical plans. That's part of the essential benefits, minimum coverage. And finally, effective January 1st, there's this new mysterious exchange in California. It's called Covered California, and it's www.coveredcalifornia.com, also referred to as the marketplace. But we mentioned that we did a lot of training to make sure we understand the law and how it compares to the TakeLessons group plans. And let me give you some very specific examples that we want to make sure everyone's aware of. First and foremost, anyone can enroll in the plan, even if you have coverage through your employer, like with TakeLessons. However, one of the main reasons that anyone would want to enroll in the plan would be if their employer did not offer coverage, or if their employer did not offer adequate and affordable coverage. Because in those circumstances, that is the only circumstance by which individuals can be eligible for what we call premium tax subsidies. In other words, help from taxpayers to help you pay for your premium. And that is the main thing that makes the exchanges potentially lower cost than what you can purchase through your employer. But there's some very important things to understand. If your employer is offering affordable and adequate coverage, which TakeLessons definitely is, you are not eligible for these subsidies. So if you are not eligible for these premium tax subsidies, there is no real true reason to go to the exchange because coverage is going to be too expensive. It's not going to be more cost advantageous. In addition, in the exchange, any premium you pay for cannot be paid with pre-tax dollars. You only pay for it with post-tax dollars. There's a little bit of disadvantage there buying through the exchange. And then also the networks are much smaller through the exchange than they are through the private group plans that TakeLessons is purchased through Anthem. This is huge. A lot of people don't understand that dynamic. The network that TakeLessons has invested in for its employees is the largest and full, robust network that we've all been used to. The provider networks in the exchange are usually about a third or half of that. So be aware of that as well. If you do decide to skip out, go to the exchange, then know that to double check to see if your doctor's in it. And also the plan designs tend to be, unless you're below a poverty level, 250% of the federal poverty level, which is around 20 grand roughly per year annual salary, then you are not going to be eligible for plan subsidies, and therefore the plan designs are actually going to be quite high and unaffordable, not affordable. For example, the out-of-pocket maximum is about $6,400 in most of the exchange plans, whereas your plans, as you will see later on the slideshow, are much lower and much better. So here are the different plans you're offered through TakeLessons. You have your Anthem Blue Cross PPO, 2 PPO plans to choose from, and then you have a HMO plan. Once again, if you have a pre-existing condition, you'll want to enroll in the HMO plan because those are all covered. And then you have an excellent dental plan through Principal. And then your vision plan is through the ever so popular and large network of iMed that includes Lenscrafters and several other retailers. And then we're going to go into what coverage is 100% paid by TakeLessons, just a gift to you. And that's going to be $25,000 of life insurance, an employee assistance program. And then finally, there are additional products that you can conveniently purchase as an employee through your paycheck through the insurance company Colonial. So, monthly premium share, we always like to remind you that your share of premiums when you buy through your employer can be paid for by pre-tax. So picture every single dollar you spend on premiums through your paycheck is not going to be federally or California taxable. So if you're spending about $2,000 a year on your share of benefits and you're at the 25% combined tax rate, then you're saving basically $500. So that's a significant advantage, and your true cost is only $1,500, not $2,000. So there really is a definite tax advantage by paying through your paycheck for these benefits. And if you look at the premiums here, they're very affordable considering the coverage that they're offering. They're very strong plans. The reason why we don't have the list of medical rates is that they do vary based upon your age and the plan design that you elect. So that will be provided to you by Talent and Culture and your enrollment specialist. So some key definitions to know as we proceed through the slideshow. The premium is once again your fixed cost. It doesn't vary until you have a birthday and your rate might go up, but other than that, it's the fixed cost you pay and TakeLessons pay for your insurance coverage. And the portion that you pay is paid with pre-tax dollars through your paycheck. The deductible is, just think of the auto insurance. It's always an excellent parallel. But if you were to crash your car, you'd pay what? A deductible, and usually it's $500 or $1,000. Very similar with these medical plans. On the PPO plans, there are deductibles that you must pay first before most of the benefits kick in. That's what a deductible is. That is different than the out-of-pocket maximum. A lot of people get these confused, but you see the last item on this slide, the out-of-pocket maximum is probably the most important thing to concentrate on as you're looking at your benefits. That's the maximum amount one can pay in a given calendar year in total out-of-pocket copays and insurance. That relates to what your share of expenses are at the time of care. That does not include your premium. So when you really look at what your total out-of-pocket exposure is, you're going to want to look at what are you paying in premiums, consider its tax advantages, but then add that to what your out-of-pocket maximum is, and that could be your worst case scenario. Co-insurance and co-pays, it's what it sounds like. It's your co-share of the payments whenever you access coverage, and it's your share of the cost. And co-insurance is basically a percentage, where a copay is a flat dollar copay. So for example, office visits that are not preventative care will be a flat dollar copay on the PPO 40 plan, for example, $40. And then that covers the entire office visit. So medical providers, we want to take this opportunity to once again remind you that you are with the Anthem Blue Cross, and that is the largest network in the United States. And what does that mean to you? That means that you have a larger access of doctors, once again, larger than what the exchange would offer. You also have the largest pre-negotiated discounts. When you go to Anthem Blue Cross providers and you show your TakeLessons Anthem Blue card, Blue Cross ID card, you get discounts of usually in the range of around 45% of what they charge if you didn't have insurance. So that's huge. Just a couple reminders. Your HMO network is a special network called the Select Network. So when you're searching the website, you'll want to select on the pull-down menu the Select HMO network. And then for PPO, and that's obviously important because when you enroll, you're going to be on the HMO plan, you're asked to select a primary care physician. But for the PPO, for both of the PPO plans, you do not need to select a primary care physician. And you also get to have direct access to specialists. On the HMO, one has to go through primary care physician to get to specialists. They have to first go to the primary, then they get to go to the specialist. So there's a little more time involved and time investment for the HMO, where the PPO, uh, you can just go direct to specialists without going to a primary care physician. It's a nice perk of the PPO plans. So let's look at the PPO and compare to the HMO benefits. What you're going to find is the HMO plan actually has the lowest co-share of co-insurance and co-pays. But once again, you must follow the HMO rules. And then the PPO plans, we've given you a high and a low. This plan actually happens to be the low, meaning it's a lower cost, but it's also lower benefits. The calendar year deductible, once again, the amount you pay before benefits kick in is $1,500 for a single. And your total out-of-pocket max, which I told you is the most important thing to look at, and that's why we bolded it, is $5,000 for a single person in every given calendar year. So every calendar year it turns over. So January 1st, 2014, that will start over. So that's something to be aware of. But on all of these plans, we're highlighting in yellow that because of Obamacare, preventative care is covered at 100%. So you're already paying higher premiums to cover that, so you might as well get it. It's a good encouragement for you to go out and get your preventative care. So we highly recommend you scheduling that. Also, this plan, because it's lower cost, it does once again have lower benefits. If you go for a doctor because you're sick and it's not something preventative, you will pay a 50% co-insurance after the deductible. So you'd pay your 100% of your costs up to $1,500 deductible. Then the 50% benefit kicks in where you pay 50%, insurance company pays 50%. So as you know, costs are very expensive at the providers. Providers in the United States charge the most out of any other country. And if you're paying a share of the percentage, you probably got to be wondering, well, when does it stop? Is there a ceiling to it? Well, that's exactly what the out-of-pocket maximum is, and on this plan, it's $5,000. So know that the bleeding will stop, so to speak, and there is a cap to what you spend in coinsurance on your benefits. Now, this plan is great for a buyer that doesn't get sick very often and wants to have lower fixed costs and understands what the benefits are, but it does not include brand name drugs. You can see that brand name drugs are not covered, neither are non-formulary drugs, so it's really only covering generic medicines. So this is really a base plan, and if you have prescription drug needs, you'll probably want to elect one of the other two plans. So we're going to give you a real life example, a case study, and we're going to give a case study for each of the three medical plans. And in this case, this is once again the lower option one. You're going to see you're going to spend quite a bit out of pocket, especially when you first start the plan due to the $1,500 deductible. So in this example, we use the name Rob is feeling sick. He goes in for a doctor's exam. Because it's not preventative care, he does have to pay his share of 50%. And in this case, he has not yet hit his $1,500 deductible, so he'll pay $65 of the $130 that would normally be charged. Then the doctor determines that he has an x-ray. Once again, because he has not yet hit the $1,500 deductible, he pays the full $900. So at first it's going to feel like you don't have insurance, but in reality, it's all being tracked by Anthem Blue Cross automatically. And then once you hit your $1,500, then the benefits start to kick in and it's going to be a lot lower cost. So in this example, the total out of pocket for Rob was just over $3,000. So once again, if it was something more severe, he was in the hospital for weeks, his insurance caps out at $5,000. So in this example, Rob would be at $3,000 out of pocket. Once he hits $5,000, his costs, out of pocket costs end for the most part. So HMO plan, you'll take a look at this now and you'll see why it's a desirable plan. Has much lower copays, much richer coverage, and all you have to do is follow the rules of coordinating all your care through the primary care physician. So in this case, there is no deductible, which is fantastic. The calendar year out-of-pocket maximum is lower than the last plan. It's only $4,000 per individual. Preventative care, once again, at 100%. And then you can see here the lab and x-ray, there's no charge for low-cost lab and x-rays. If you get a CT or MRI, it'll be a $100 copay, but at least for most lab and x-ray, it's 100% coverage. And also for non-preventive care, unlike the last plan, they're flat copays, and you just pay the flat copay and the entire visit's covered. $40 or $50 if it's a specialist. So clearly this plan has much richer coverage, and it has brand name prescription drug coverage. You'll note that there's an extra deductible though, or it's the only deductible in the plan really, because it's for prescription drugs only if you use brand name drugs. So there is an incentive to use generics, and we definitely recommend it. If you do get a brand name, it is covered. It's just you have a deductible first of $250 per calendar year. So just a reminder again, the rules of the HMO: you must elect a primary care physician. If you don't select one, Anthem chooses one for you that's near your home, and it'll be listed on your ID card. And you must receive a referral from that PCP before going to specialists. The only exception to that would be for women who go in for their OBGYN care. That's, you can go automatically to the OBGYN, which is nice. That is actually by law, and that saves you time and money. You can change the primary care physician if you don't like that doctor. You just have to give it about a month or two for it to change in the system. So it's not immediate. Last reminder, very, very important. If you absolutely have to go to a Scripps Clinic doctor or a UCSD doctor, they are not providers that are inside the Select HMO network. Pretty much every other doctor in San Diego is covered in this Select HMO network, except for Scripps Clinic and UCSD. So if you do want those two providers, you can know that while they are not on the HMO, they are on the PPO plans. So next slide, if you recall, we did this for the last PPO, low option PPO plan. In this example, or the base plan, this is your HMO plan. And in this example, you pay much less. Instead of paying around $3,000, you're going to pay a total out of pocket of $780 for the same exact procedures. So obviously the cost is a lot lower out of pocket for you. And all you have to do is just coordinate all your care through primary care physician. So that is definitely a nice feature of the HMO. So here is the high option PPO plan. As you can see here, the deductible is clearly lower. It's half of what it was of the other PPO plan at only $750 per individual. The out-of-pocket maximum, though, is still the same at $5,000. And then you also get preventive care covered on 100%, just like the other two plans, as long as you go to in-network doctors. And then in this example, your share is lower than the other PPO plan. It's only 40% as opposed to 50%, and the insurance company is going to cover 60%. And of course, you have to hit the deductible first. But this PPO plan, if you want a PPO but you want brand name drug coverage, this is obviously the one you want to select because it has brand name RX coverage, and the deductible on it's only $150. Whereas on the other PPO plan, it didn't even cover brand name drugs. So what would be your out-of-pocket expenses in this type of plan? As you recall, the low option PPO was around $3,000. The HMO was $780. This is somewhere in the middle. And keep in mind that this is just a standard example of someone accessing care. Remember, if you have care needs where you have something like this example where Rob has all these episodes, and then later you need more care, your coverage is going to get only better as you proceed through it, because remember, in this example, you would have already hit your deductible, and therefore you'd have lower out of pocket the second time around you access services. So, and once again, a very strong reminder, there's a cap to your expenses out of pocket. Remember, insurance is not intended to be full, you pay nothing. It's intended to help you with your costs. So if I had to give you some walkaway tips, this is how to be a smart healthcare consumer. These are actually hugely important. Take time to understand this slideshow. We know it's not exciting, but it's really important, especially when you need it. And it's an important part of your compensation package that TakeLessons has invested in on your behalf. And just like any insurance, it's only until you really need it that you fully appreciate it. So remember, if you're a PPO enrollee, you are given the freedom to go to direct refer to any provider you want, but with that comes some responsibility. You want to make sure that you're choosing providers that are inside Blue Cross's network, because your expenses will be much lower and your benefits will be much higher, and your out-of-pocket costs will be much lower as a result of that. So we encourage you to shop for providers that are lowest cost. Ask them what they're charging, just like you do in any other industry when you go shopping for food or cars. You'd be surprised to hear, but one of the biggest complaints about the U.S. healthcare system is that an MRI at one location on one street can be 2 or 3 times higher cost than the same exact service, same exact machine, just a block away. And it has happened. That is a real true story. So what we want you to do is know that reality, and we encourage you to ask around and try to get the lowest cost because you're sharing in the cost. You might as well educate yourself and shop around. Also, ask your doctor if they have a generic medication available. A lot of drugs are mandated after they reach their patent around it's around 20 years. But once that's been reached, generics must be made available, and they must be exactly matching to the brand name drug. So some drugs do not have a generic equivalent, and you might have to bite the bullet, and you have no choice. But more drugs than not have a generic equivalent. Also, know where your urgent care center is. If you're on the HMO, it's where you signed up with your primary care physician. If you're on the PPO, you can go to any urgent care center inside the Anthem Blue Cross network. So knowing where they are ahead of time will cost you a lot less out of pocket because they're much lower cost than going to the emergency room. Also, brand name drugs. If you were taking a maintenance medication, maybe it's allergy, birth control, asthma, diabetes, these are all things that you take on a regular basis. We highly encourage you to roll in the mail order program. What is that? Drugs come directly to your doorstep. You get a 3 times the supply for only 2 times the cost. So you save money and time. Starting up, it takes a little while to kick in. You get your doctor to get a 90-day supply. You fill out the form. You wait for it to kickstart in about 2 or 3 weeks. Then after that, it's gravy. All you have to do is call in. You save the number on your cell phone. And when you get referrals, it's already automatically billed to your credit card, and all of a sudden it arrives at your doorstep. It's incredibly convenient. I do it personally and highly recommend it. So on to the other benefits. TakeLessons has invested on behalf of its employees in a fantastic dental plan. It's through Principal Financial Group. This has an excellent network of providers, and what's cool about this plan is there's 3 different ways to access care, and based upon how flexible you want to be. If you are comfortable and okay with going with a list of dentists, there's about 2,000 in what we call the EPO network. If you look on the Principal website and search for providers within that tier of providers, once again, there's 2,000 to choose from. Your benefits are extremely rich. You get up to $15,000 per calendar year of benefits. You have no deductible. You get 100% preventive care without having to pay a deductible. So just no question that if you do not have a dentist that you absolutely have to see, that's the tier of coverage to go to. But what TakeLessons wanted you is to have the flexibility that if you have a dentist you really like, you can still keep going to them and you can still get benefits. It'll just be that your coverage will be less and you'll spend more out of pocket. So you are empowered to make that choice. And as you move outside of these networks and you go to any dentist you want, which is tier 3 in that example on the far right, you're going to spend a lot more out of pocket. You're going to have deductibles, and it's just more expensive for you. But at least you'll have some form of coverage. I do want to highlight something that I like is that middle tier, the PPO, is, you may ask what that is. That's also a network of dentists, and that's a little bit better than the EPO, but not. It's a little bit better coverage than the out of network tier, but it's not. But it's still good and affordable. So let's give a case study example of an employee that's getting a cleaning and X-rays, and the approximate out-of-pocket for getting the same procedure done through 3 different tiers. Once again, to highlight, if you go to an EPO tier, it's $24. If you go to a tier 2 provider at a PPO, it's $44. And if you go out of network, it's a whopping $108. So a clear and obvious example is you really want to go to the EPO tier of dentists. So vision coverage. iMed is a huge vision provider. They are have J.C. Penney, Lens Crafters, a huge slew of providers to choose from, and the coverage is fantastic. And like the dental plan, you can get better coverage if you choose to go to eye doctors within the network, but if you go out of network, you're going to be reimbursed and have less coverage. Here's a case study, and look how much less you spend out of your pocket if you go in network. Significantly less versus going out of network to any vision provider you'd like. So there are benefits, once again, that TakeLessons pays 100% of, and that's the life and AD&D coverage, automatically paid for by the company, $25,000. So we just want to make sure that when you sit down with your enrollment specialist, you do elect the beneficiary. That would be the person who receives the money in the event of your death, and make sure that you bring their date of birth to the open enrollment meeting. Just a reminder, you want to make sure the right people get your money. Finally, there's another important resource that TakeLessons is paying for, and that's called the employee assistance program. For any of you that have never had it, this is an excellent resource that provides consultation, advice, therapy, and resources, and it's all 100% confidential. So we all know in today's world, you may have family problems, work problems, mental health issues. This can all be an outlet for you and resources for you to get for your entire household, even people that aren't on your medical or dental plans. You can get coverage to get the resources you need. So if your roommate's having trouble, you can actually refer them to this, and they're covered. Once again, very important to know that it's 100% confidential. So uh, we're almost done, but just a reminder: when you sit down with the enrollment specialist, they're going to bring up some other lines of coverage for consumers, and that's that you pay 100% on your own dollar. You get to pay for it through your paycheck, but you should be aware that there's a cancer plan, there's an accident plan, basically coverage you get if you have some sort of accident. Same thing for a disability. If you get disabled, in this example, a bike injury, you can get coverage for your income, and that's also a very important benefit, especially if you're a sole breadwinner or if you don't have family resources to help you in the event that something terrible happened. We all have friends who've had something like that happen. Unfortunately, the state plan by which you're paying for it is only 55% of your income. So if you're living on more than that, more than 55% of your income, you're going to want to consider purchasing coverage to give you more than just 55%. So when you sit down with an enrollment specialist, they'll talk to you about that. And once again, you get to pay. These are some reasons why to do it: convenience of paying it through your payroll, and potentially pre-tax dollars, and you get to own it on your own. So last but not least, this is an opportunity to take this information to your family, replay the video at home, put some thought and discussion on your enrollment, because it will be locked until your next open enrollment period. And also bring your beneficiary information, date of birth of those that you want to make your beneficiaries, and make sure if you have dependents you're enrolling, bring their date of birth and also their social security numbers, because you will need that when you enroll. Last but not least, you will be sitting down with an enrollment counselor who will provide you with either a hard copy or electronic enrollment. And so you obviously want to make sure that you take care of that as soon as you meet your eligibility period. That way you confirm whether or not you're enrolling or not. Well, thank you again for the time, for listening, and please note that you can contact us at any time, Alejandra or myself at Discovery Benefit Solutions, and we hope that you enjoy these benefits that have been provided to you. Thank you so much.